Hi everyone, my name is Mike Zucala and I'm the VP of Marketing at Crown Aesthetics, and I truly hope this finds you, your families, and staff all healthy and preparing to get back to work. Remote learning is more important today than it's ever been. That's why we're so proud to sponsor this Best Practices video series, which is designed to provide you and your staff highly practical advice in a quick and clear manner as you prepare to get back into your practices and start seeing patients. We hope you find it helpful. This week's best practice comes to us from Dr. Yael Halaas, a facial plastic and reconstructive surgeon in New York City. Since Dr. Halaas is based at the epicenter of COVID-19, she has adopted a very comprehensive set of protocols for her practice, designed to maintain patient safety and exceptional staff productivity. We hope you find them helpful.
We are really in challenging times, and with everything going on with COVID, it's really important to educate your staff and your patients with all the changes that you're making before they come to the office. So for both patients and staff, we've created a lot of ways to make it much more efficient and to make everyone a lot more comfortable before they get into the office. For patients, we've made a couple of changes. One, we've created on our website a whole page educating them to all the changes that we've made. In addition, we've created a lot of blasts on our social media so that they can feel comfortable and know what to expect. In addition, on our patient portal, we have a checklist so that they can familiarize themselves with some of the things that they're going to need to do or some of the things they need to know before coming into the office. In addition, it also gives them a personalized email so they also know what to do and what to expect. And also, very simply, a phone call. When they make that appointment, they're speaking to our staff member and they know that they're going to have to be wearing, for instance, a mask when they come in. And if they have a fever or if they've been exposed, and they're also going to get that with the COVID questionnaire that they're also going to be getting on their patient portal. To prepare our office for opening, we've had to go over a lot of strategic areas to get ourselves prepared. That started with staff education and really understanding the new guidelines. How have we done some of those things? In terms of staff education, we've had our staff going over a number of webinars, getting mandatory testing, quarantining, taking their temperatures upon entry to the office, following the guidelines from the New York State Department of Health, the Medical Society of the State of New York, Quad A, who credits our OR, the Governor's Office. Every staff member receives a COVID orientation prior to starting back in our office. In addition, we've had a whole orientation and a whole new way of scheduling appointments. We have a whole new type of pre-arrival direction, and that's thanks to our new portal. Now, when patients arrive to our office, they all must be wearing a mask. Patients who are sick, of course, are rescheduled. That's the same as before. But we have a really strong emphasis now with telehealth. We also do telehealth consults for all of our patients before coming into the office. This really confirms what we're going to be doing for the patient that day. We're really not adding on, which is something that we used to be doing before and anything would encourage. But now we really are trying to keep to a tight schedule. Why are we doing that? Because we really have to make sure that we have enough time between patients that we can clean the rooms. In addition, we really want to make sure that all paperwork is filled out using the patient portal. We don't want to have patients in the waiting rooms at all. We need to make sure that patients are notified by the patient portal and taken directly into the room. The rooms are scheduled specifically per patient and per provider. Before, we were just scheduling per provider. But each room is directly scheduled per patient in advance. They're in and out of the room. They're going directly into the room. The waiting rooms have been completely changed. We don't offer water or refreshment anymore. Our brochures have gone. And patient temperature is taken upon arrival, and then they go straight into that specific room. Besides changing completely office flow and making changes to our waiting room and the physical structure and the scheduling of our office and in the addition of the patient portals, we've also changed some of our paperwork. For our OR and as well as just for our consent forms, we have made COVID-specific consent forms, COVID-specific questionnaires, and COVID-specific guidelines related to the operating room and related to everything that we do in the office now. The treatment has already been confirmed through their telehealth appointment. Everything is set for the patient. We're doing this to make sure that the appointment can be seamless and with minimized contact with our staff. Everyone is protected. The patient can only be accompanied by one other person if they are a minor. So we have minimal patients, minimal visitors. That keeps all of us safe. We also have post-procedure phone calls and standard operating procedures, which always allowed for phone calls and non-person-to-person visits. So that's something that we've always been doing, but particularly in these times where we're trying to limit contact and exposures, that's something that we've been finding important. And I think with the development of telehealth, that actually is a positive because it allows for more interactive with our patients, but not necessarily just by using a phone call. We can actually use maybe FaceTime or the development now of telehealth, a protected portal, to actually follow up and see our patients. With minimally invasive procedures like skin pen, one of the most favorite procedures in our office, we do have to have some considerations for use of personal protection equipment. So for the providers, we're going to be using face shields, N95 masks, gowns, and gloves for the procedure. It would be advised for the patient as well to be using N95 masks. For elective medical procedures, it is required that the patients do receive PCR testing 3 days prior to the procedure. I would say to stay tuned to your local guidelines as these may change.